In the cadaver we can see this is the urinary bladder location. So this is the urinary bladder. Behind that we can see the uterus over here, and this space which is lined with peritoneal fold, this space, this fold of peritoneum is known as uterovesical pouch. So this pouch is known as uterovesical pouch, and anteriorly we have this urinary bladder. Now in this video we will see the anatomy of the urinary bladder. So this is the urinary bladder, and it is a urinary organ which is located in the pelvic cavity. In case of children, it is an abdominal organ, and as the anterior abdominal wall increases or develops, it comes to lie in the pelvic cavity. And in the adult position, it is a pelvic organ which is located in the true pelvis. And the normal capacity of the urinary bladder is 220 ml, and it can be increased up to 450 ml. And the anatomical features include the apex. So this is the apex of the urinary bladder. It is tetrahedral in shape. This bladder is tetrahedral in shape. It is having an apex. So this is the apex. At the apex we have the attachment of the median umbilical ligament, which is the remnant of uterus. Then this is the base. It is also known as posterior surface, and it is including the seminal vesicle. These are the seminal vesicles, and this is the vas deferens. So these are the identifying features for a male urinary bladder. And the upper part of this posterior surface is covered by a peritoneal pouch, which is known as the rectovesical pouch, this part. So this is the apex, and the posterior surface is known as the base. Then the rest is, this is the superior surface, and these are the two inferiolateral surfaces. These are the inferiolateral surfaces, and this is the superior surface. This superior surface is covered with a fold of peritoneum again, and this peritoneum separating the superior surface from the coils of jejunum and ileum. Then these are the two inferiolateral surfaces. These are separating from the lateral pelvic wall by the levator ani muscle and the obturator internus muscle. Then we have the borders. These are the two lateral borders. These are separating the superior surface from the inferiolateral surface. So these are the two lateral borders. Then the anterior border. This is the anterior border. It is separating the two inferiolateral surfaces from each other. And this is the posterior border, which is separating the superior surface from the posterior surface, that is the base. Then we have in the filled urinary bladder, we have the dome-shaped area above. This is the fundus, and this constricted portion over here, which is surrounded by this gland. This gland is the prostate gland, which is found in case of males. So the neck, which is the constricted part, is surrounded by the neck, and this dome-shaped area above the superior surface, this is the fundus of the urinary bladder, and the rest part is known as the body of the urinary bladder. Now we see the interior of the urinary bladder. At the interior we can see this roughened area. These are known as the rugae. These are because of the mucosa of the urinary bladder. So this mucosa is not adherent with the submucosa, that is why it is forming these temporary folds. These are known as the rugae. At some place, that is the triangular area, which does not having such kind of rugae, because this mucosa is adherent to the submucosa over here. This triangular area is known as the trigone of the urinary bladder. This trigone is bounded laterally by the openings of the ureters. So these smaller openings, is the opening of the ureters on both the sides, one on the right, one on the left. Then inferiorly, this urethra, this is the opening of urethra, in which we can see this is the opening of the urethra. This is the lower boundary of this urinary trigone, and the openings of the ureters, these are bounded above by this bar. This bar is known as bar of Mercier, which is known as intraureteric ridge. It is 2.5 centimeters long in empty urinary bladder and 5 centimeters long in a filled bladder. this bar of Mercier provides the sensation of filling of the urinary bladder to the brain. So this is the interior of the urinary bladder, and here again we can see this is the median umbilical ligament, which is the remnant of the uricles. So this is the another specimen. It is again a male urinary bladder. Over here we can see the prostate gland, and this is the opening of the urethra, that is the prostatic urethra, which is continues downwards as the membranous urethra. So this is all about the external and internal features of the urinary bladder, and it is supplied by the superior and the inferior vesical arteries. So this is all about the anatomical features of the urinary bladder. Thanks for watching.